So we're going to give some local anesthesia for this patient before we start off with the earlobe repair. It's a very simple injection. Just the lobe is going to get numb, and we're going to close it in 2 layers, both on the outside and on the inside. So once we get the patient on the monitor, then I'm going to give a small injection. You'll see that. Hold down, what to yeah. Oh, but down for the blue. Hold towel, hold first bed towel. Before we give local anesthesia, just going to clean up the area around this. We're going to make sure it's sterile. Also put a little bit of a plug on the ear and clean up both the areas. Once we do that, we will apply a sterile towel, a drape. Sure. So this is the local anesthesia. சின்ன ஊசி போட போறேன் சரியா So I'm trying to inject everywhere with just one prick, and I don't want to take it out and then inject. So you see, I went this way first and then I went this way, and I'm doing it again, and it just bloated up, and I've not even injected 1 cc. So when you do these repairs, I don't want to inject too much. I just want to make sure we have just, and you can see the way it's blanching. Just going to blanch more, and that's enough. So we will wait for a while. And that's the spot where I entered. And you see the patient has not made any noise, so it doesn't hurt much if you distract the patient or give the injection in the right plane slowly. And then now we wait for 5 to 6 minutes. 5 minutes is ideal, 5 to 7 minutes, and then we can start off with the procedure. So local anesthesia is a very nice technique for a lot of procedures, and we use it extensively here at Richardsons. We make use of various blocks that we can use: the infraorbital block, posterior superior alveolar block, the greater palatine nerve block, auriculotemporal nerve block, and so on and so forth. And these blocks give us anesthesia in specific regions, and a lot of procedures can be done